to demonstrate how to place a spoon splint onto a patient. We're going to have all of our supplies ready in advance because preparedness is a good thing. We're going to start off with our primary layer. If we have a foot that has a wound on it, we're going to place a Telfa pad on top of the wound. Then we're going to need to place some stirrups, which are made out of porous tape. Your tongue depressor is used so that you can place the tape on the patient's foot without having the ends of it stick together, and you'll see why that's important later on. Cast padding is just a very thin cotton. Some of it comes with a textured pattern on it. We also have stretch gauze, which is commonly called cling, so you might hear that term. And it's stretch gauze because you can see through it that it's gauzy, but it also has a nice stretch to it. The splints, in this case, we have a front foot. We're going to be using a spoon splint, which is a nice straight splint. Most of them are green, some of them are blue, but they're nice and straight. There's also a splint called a quick splint that is shaped to the leg. This one in particular is for a rear leg, but we will not be using that today. There's also vet wrap, which is sports wrap or Coban. It has stretch to it. And then you have your elasticon, which is going to protect the areas that the pet walks on. For a list of what you're going to need, you're going to see the list on the wall there. Extra items that you might need available to you will be bandage scissors, so that you can cut your material as you go because you want it to fit your patient's leg. And especially when you have a wound, but you're going to want to put some exam gloves on. And that would be all the supplies that you need.